Good afternoon, Kevin. How you doing today?
Hey, how are you?
Very well, thank you. So you were here a few months ago. I'm thinking, what was it, like 4 or 5 months ago for your Botox?
Yeah.
And we had a nice little treatment plan for you. Did you like what I did? Did you like the way everything turned out?
Yes.
Awesome. Let's not mess with success. We'll do everything exactly the same. I keep in my charts a very careful diary, both written down and a drawing, so I know all my thought processes of why and how I did the Botox, so that when someone comes back and says, that was perfect, do it that way again, I'm like, okay, I don't have to reinvent the wheel. I know what I did before. But sometimes people do come back and say, you know what, it was great, but could you try to just get the crow's feet maybe a little bit more, or get my eyebrows up a little bit more? And one of the wonderful things about Botox is that we can modify each time what we do using that feedback. Can't do that with surgery. You know, once it's done, it's kind of done.
Yeah.
So that's a wonderful thing about Botox. And you know, as people go through the years, sometimes their needs change. They might age a little bit, but sometimes their goals change. And they decide, oh, you know what, I think I do want my eyebrows a little bit higher or whatever. So we can always adapt and make those changes for people. All right, so, you know, I was thinking today when you were coming in, have you ever seen what Botox looks like before we give it to you?
No.
Want to?
Yeah.
Okay. So here is a vial of Botox. You see it still has the little lid on there, and I haven't prepared it in any way. Take a look at that and tell me what you see in that vial. Does it look like it's an empty glass vial?
I don't see anything at all.
Right. It looks completely like there's nothing in there, right? So many years ago when the Botox people came to me and said, yeah, here's what our Botox looks like. Take a look at it. It's a couple of $1,000s, you know, for that vial there. And I'm like, you're selling me an empty vial. This is like the emperor has no clothes, you know? This is like, what is this? But look again, if you look really carefully, you'll actually see there's a very thin, pale white line kind of at the bottom.
Little crystals on.
Right.
Yeah.
That's, you know, us old guys would say that's the freeze-dried Botox. It's actually sitting inside this vial, completely inactive, inert, and it could stay in that vial, refrigerated, for a very, very long time. It's not active at all. It's useless. It's like dormant. And until you come in, it stays like that. As soon as you say it's time for Botox, we add a little bit of sterile liquid to this vial, which is a vacuum, by the way, so that also helps preserve it. And at that moment, it now becomes activated and ready for use. And you gotta have fresh Botox. It's not like a fine wine. The fresher, the better, okay? All right, so I've got my plan, I've got you. Let's have you ice for a couple of minutes like we like to do before our treatments, and then we'll get your Botox started, okay?
Sounds great.
All right, Kevin, you've had a couple of minutes to chill, relax, literally. Let's take that from you. And again, just to go over our plan, as we figured out last time, we want to get it just right again. We're going to come in here and soften in here, soften in the forehead, give you just a little bit less of a heavy look on the eyes, lift the eyebrows up a little, and into the crow's feet. And you know, whether someone is a man or a woman, everyone has their own personal desires about what they expect and what they're looking for with Botox. I assume nothing. So when I'm talking with someone about what their goals might be, I want to achieve the goals for that person. Some person wants their eyebrows arched, someone else doesn't. To each his own, I say. But this is again one of the beauties of Botox. I can adapt my treatment for the look that you're looking for. And sometimes men are looking for certain things or women are looking for certain things, but you know what? To me, it's just people asking for the things they want. Whatever they want, I'm gonna give it to them if I can, and most of the time I can, all right? So I'm just gonna have you rest your head back. We're gonna clean off with a little bit of alcohol. And again, not wanting to separate from the union requirements that all doctors must use alcohol at all times. We're gonna just clean things off a little bit, okay?
Okay.
All right, Kevin, let's get started with our Botox. Just a couple of little tiny love bites. We're not gonna call them pinches. How we doing? You okay?
Yeah.
All right. Fabulous. Let's get a little bit in here now. Fantastic. We do a little bit in the forehead. All right, Kevin, I notice also you like to wear your hair kind of pulled up like that, and you have one or two lines that are right up near your hairline. And I know from treating a lot of patients, that one at the way at the top, if you pull the hair back, male or female, it bugs you. So we're gonna make sure we get that today a little bit too, okay? And there it is. She's good. Kevin, you did great. How you feeling?
Feeling great.
Awesome. How long did your Botox seem like it lasted for you last time?
It was probably going around 5 months.
Oh, that's awesome,
Yeah.
awesome. Well, you're probably going to expect the same. Please don't tell everybody yours lasted longer than the average person, okay? We have too many jealous people out there, okay? Because it usually lasts about 4 months, so 5 months is really good. And does it kick in pretty quickly? When do you start to see it?
Started seeing like...
Within like a day or two, maybe?
Like 3 days.
Some people it takes a little bit longer. One of our other patients today said hers takes, you know, sometimes close to 2 weeks. So that's good. That's good. But it isn't like a dramatic thing. It kind of creeps on slowly, even over those 2-3 days, right?
Yeah.
All right. Well, we're just going to have you just chill for a couple more minutes, and then we'll have you on your way, okay?